principle of trying to make this happen really well, not just that we have a meeting, not just that the spirit of the law is, sorry, the letter of the law is followed, but the spirit of it is, and we really do this as well as we can. And that's what our amendment is about. There are actually very different ways of making these things work. They do work in very different places, already. And they have lots of scope to learn from each other at the local level, and indeed government, central government has scope to learn from them all. The amendment is very self-explanatory, so I'm not going to go through it. Basically, it's looking for a report on all the different aspects of the way this clause is playing out on the ground. I am keen to move it, but I hope it is one that the government might accept, at least in some form.
Thank you very much, Sir Edward. Very good to see you in the chair. I think everybody agrees with the principle of this. There is undeniable value in having all the relevant agencies working together, and I'm afraid it is invariably a conclusion of reviews when things do go badly wrong that part of the issue is generally about that not working as well as it could do. Now, clearly, this piece of legislation does not invent multi-agency working. It's not a new thing, but it does write something very specific into legislation, into primary legislation. That is a welcome thing. I do think Amendment 19 is a good and important amendment, requiring there to be reporting back on the work and the impact of multi-agency teams, because what we need to focus on is actual practice. So whatever you set out saying, well, so-and-so must talk to somebody else, that is one thing and no one's going to argue. But as my honourable friend has said, of course, there is quite some variety in the way these things happen. So I'll ask the government, is there going to be more guidance in terms of operations? To stress, obviously, the importance of following process and procedure, but not only following process and procedure, also the recognising the centrality of professional curiosity, taking ownership of problems through to their solution. I'm also keen to understand better from the government the extent to which this that's been proposed is the same or different from multi-agency safeguarding hubs, commonly known by their acronym MASH, or is this for a subset of cases, a higher level of cases where, in a sense, we're drawing a distinction between safeguarding and child protection? MASHs themselves have worked in quite different ways. I mean, I said these things aren't new. I remember in 2012, when I was in the Education Select Committee, when we did an inquiry in this area, we visited a couple of different MASHs. We also had a couple of different local authorities into a committee hearing. One was Devon, one was Leeds. One of those authorities had a MASH. The other had actually decided not to because they felt there were better ways of achieving some of the same aims. But again, really highlighted the importance of what you do operationally, what you do in practice. Frequently, we were told about the advantages of physical co-location, just the simple point of being in the same room, facing each other across the desk. But of course, that itself doesn't guarantee people will work as well together as they could. Relationships are incredibly important, and so is the willingness to appropriately share information. And arguably, you can do that these days in ways without co-location that you couldn't do in the past. As far as I can make out, this proposal doesn't adopt the principle from what we used to call the Troubled Families Programme, now the Supporting Families Programme, of having a designated key worker for each individual family. And I wonder if the government might say something about why that is, or if indeed it is their intention that should be the case. And more generally, it'd be interesting to hear how this programme relates to how it works with the Supporting Families Programme, I say formerly and probably better known still to many as the Troubled Families Programme. Of course, it was then, at the time, was Louise Case. In fact, the creation of it straddled the previous change in government. It started in pilot form, research form before 2010, and then came into being fully after 2010, of course. Louise Casey is now Baroness Casey of Blackstock and still very involved in incredibly important work. But you can see some of that supporting families or troubled families work as being the key upstream stage, where sadly sometimes we end up in child protection territory. And in her, now Baroness Casey's report called Listening to Troubled Families, some of the common features that were identified: abuse, institutional care, violence, mental health problems, drug and alcohol abuse, and so on, obviously are incredibly prevalent in this group. So I hope the government can say a little bit more about how these programmes will work together, particularly as I think just about now that programme, the Supporting Families programme, which used to be in MHCLG, is now, I don't know if it already has or is coming into the Department for Education, and so there are great opportunities, I think, for good working with children's services.
I thank my friend for giving way, and it's just to really add a sharpening of one of the questions, a really good question you asked, which is, my honourable friend asks, are the new teams displacing or replacing the MASHers? Does the government think that there will still be the MASHers that exist now running alongside these things, or, as it were, does the one turn into the other? And on this point about continuity being raised by my honourable friend, because that continuity of knowledge is so important in these cases, it's often the same families in trouble for a long time. Is it the government's expectation that it would be quite normal for people who are currently on one of the MASHers to, quite a few of those people would find themselves on the new teams as well, or is this a really different thing? I'm just trying to understand the intent. Thank you for giving way.
Thank you. So I do think Amendment 19 has quite a lot of value, and I hope it will be possible to adopt it into the legislation. And I also just wanted to ask about resourcing. So there's both cash resourcing, which my honourable friend rightly has asked about how much there's going to be. Of course, there is the new burdens principle to follow, but also just in terms of staff availability, because it's one thing to legislate for people to be doing a certain thing. If it's very difficult to hire those people, then obviously that is an impediment. And to what extent, and if it's possible to quantify by how much, does this programme create a new human resource requirement? How many more person days per year are we talking about?
Thank you, Chair, and it's an honour to have you in the chair today, this afternoon, and I want to speak to the amendments, but also the clause stand part as well, clause 3, which requires the establishment of multi-agency child protection teams in every local authority area. And in relation to Amendment 19, laid in the name of the Honourable Members for Harborough, Oby and Wixton, and for Central, Suffolk and North Ipswich, I welcome the focus on monitoring the impact of the effectiveness of these multi-agency child protection teams, and indeed, as the Honourable Gentleman for Harborough, Oby and Wixton put well, the focus on continuous improvement, because it's essential that we do know how these multi-agency teams are leading to better outcomes for children, and that we share that learning right across the system. It may be reassuring to know that safeguarding partners already have a statutory responsibility to publish annual reports on their multi-agency safeguarding arrangements, but once clause 3 comes into force, this will include reporting on the multi-agency child protection teams, and we are already funding 10 local areas to implement multi-agency child protection teams. From April, we're investing over £500 million to roll out family help and multi-agency child protection teams nationally. And the evaluation of the 10 pathfinders and the national rollout of the Families First Partnership Programme, that will inform the operational detail, including reporting, that will then be set out in regulations and updated statutory guidance. And in response to the question about how these teams will work, local authorities are currently not required to have a multi-agency safeguarding hub. And so this new duty will impose a specific form of child protection arrangement, because the emerging evidence shows that with the 10 local area pathfinders, this new way of working shows that where there is that effective multi-agency safeguarding hub, local areas can build on that existing multi-agency infrastructure and achieve closer multi-agency working relationships that then will create that multi-agency child protection team. And in relation to the Honourable Member for East Hampshire's questions, Right Honourable Member for East Hampshire's questions on the Supporting Families programme, this has moved to the Department for Education, and the multi-agency child protection teams will be based on the best practice from Supporting Families. So we are very much building on where there has been good work done in recent years. We are very much building on this and taking it to the next step to make sure that as far as we can possibly legislate for, no child is left behind. And the teams will bring together the right people with the right skills so that that support is formed around the child, and also to ensure that it can address many types of harm to children, whether that's criminal gangs or through sexual exploitation or otherwise. These new multi-agency child protection teams that will build on the expertise and knowledge of local authorities, police forces, to make sure that they work on a base of geography and of local knowledge. So moving to clause 3, which as I said, sets out this requirement for multi-agency protection teams to be established in local areas. We see this as a crucial step to strengthening the safety and protection of our most vulnerable children. Every child deserves to be protected from harm, but sadly we know this doesn't always happen. So legislating for multi-agency child protection teams in this way will help ensure we have a more consistent approach nationally to child protection. The Child Safeguarding Practice Review Panel recommended introducing multi-agency child protection units in every local authority to address what is a current lack of joint working across agencies that often leads to missed opportunities to protect children in a timely way. These multi-agency child protection teams will bring together the right people with the right skills, and they will share information. They will take decisive, timely, coordinated action to protect children from all types of harm. We know that the police, the health service, the local authorities, they already share those responsibilities for safeguarding. So the purpose of this clause is to place new duties on safeguarding partners and relevant agencies regarding how they operate to ensure child protection. They'll nominate required members with expertise in education, policing, health and social work, and they can ask other agencies as well to bring their skills and expertise to work as part of that team. The flexibility will allow those multi-agency teams to work in a way that is tailored, and it can bring in expert and specialised skills and knowledge to ensure that all aspects of a child's well-being can be considered as part of this work. And within those roles and responsibilities, these teams will address inconsistencies and ambiguities in child protection practice and improve joint working, and it will stop children falling through the cracks.
Would you give way on that point?
I will give way.
I agree with everything the Honourable Lady is saying, also it's very sensible. She may be coming to this already, but on this point about where MASHs already exist, do these new bodies supplant them, as it were? I wonder if she could just address that point, just for information.
Sorry, could you just repeat?
Sorry. On this point about where there are existing MASHs at the moment, will these new teams replace them? Are they likely to have similar members? What happens to the things that exist when the new thing is created?
So, as I said earlier, at the moment local authority teams aren't required to have multi-agency safeguarding hubs. So we will build on the work that has been done and make sure that every local authority has a child protection multi-agency team, and to make sure that no child will fall through those gaps where that practice is not existing currently.
So I hope she doesn't mind me intervening to ask this question, but I genuinely haven't been clear on it from reading the legislation or the explanatory notes. Is the multi-agency child protection team part of, replacing or in addition to any multi-agency safeguarding hub that exists today?
So the multi-agency child protection teams will be based on those models, that we have the robust evidence, including the supporting families and the strengthening families programmes, and it very much follows the recommendations from the Child Safeguarding Practice Review Panel to make sure that we have a multi-agency child protection unit in every local authority to address what is a lack of joint working across agencies. And we're already testing this approach with the 10 new pathfinders and working to make sure that safeguarding partners in all areas have a consistent approach nationally, which will build on where we've seen this working in practice and where this has been working well. We will build on that, and this clause will ensure that that is delivered in every local authority and for every child.
Just for clarity, could there be a local authority in which there is both a multi-agency safeguarding hub and a multi-agency child protection team?
So this will build on the work of those teams to make sure that it's rolled out nationally, that every local authority has a multi-agency team that can deliver on those. Do you mind if I just finish answering? Fine.
I'm really sorry. I'm genuinely not trying to be difficult. I genuinely don't quite understand. So I think we all agree and absolutely support the Honourable Lady in what she says, that of course this should build on the existing work, but there's best practice in a MASH, everything that's been learned from troubled families, supporting families and so on. But I'm trying to understand if this is taking existing MASHs, and they don't happen everywhere, but they're on quite a lot of places and they work differently in some places. Is it trying to take that practice, make it a bit more consistent and give them all a new name? Or is it saying, whatever you do on a MASH, which perhaps might be for a broader group of children, looking out for safeguarding, reviewing cases perhaps at a slightly lower level, but in addition to that, whatever you do on that side, for perhaps a subset of cases, there'll be something new called a multi-agency child protection team, which might exist in parallel to an existing MASH, or does it replace it or become subsumed into it? Forgive me for the long intervention.
So, I think what the Honourable Gentleman's potentially getting at is how the multi-agency child protection teams will work alongside the MASH teams.
Yes.
And to some extent, this is moving existing resource around. This will be in addition to the MASH teams, and we recognise that it will require some additional resource. So there will be the additional resource of £500 million coming from April 2025 for the Family First Partnership Programme that will contribute to, as he rightly raised, we need to make sure we have good qualified people working in these roles, which are really important to get right. So, as I said, it is building on the good work. We are putting in additional safeguards for children through these provisions, and to make sure that, yes, where we have the good work of MASH happening, that we can now, on a national scale, have a consistent approach to child protection and make sure we have these multi-agency child protection teams working together. So I hope with that clarification that I will give way.
It's very kind of her. I do appreciate the Honourable Lady giving way. It's on just two specific questions. One is, and there may be no answer to this yet, it may be for regulations, there may be no decision yet. If a large local authority, let's say Birmingham, wants to have more than one of these things, is it able to do so? And on my other question that I raised before the break about substitutes, what happens if one of these nominated people is off sick or something, the meeting still obviously needs to go ahead? Are you allowed to do substitutes?
So I think the Honourable Gentleman is really getting into the detail of how these will work operationally and in practice, which we are obviously exploring through the Pathfinder, the 10 Pathfinder programmes, to make sure how this can work most effectively to ensure that no child falls through the cracks. And this will be set out, as I said, in greater detail to ensure that we do have a consistent approach nationally. And obviously, the point is to ensure that it can be tailored to local need as well. So indeed, different areas will make sure that they bring in that expertise where it's needed, that they add to the capacity that's already in the system wherever that is needed to keep children safe. So I would implore members of the committee to support the passing of this clause.
Yeah, right. Do you wish to speak? Do you wish to move your amendment?
To move my amendment, please.
You do want to have a vote? Okay. Amendment 19 proposed to clause 3 as on the amendment paper. The question is that the amendment be made. As many of their opinions say aye.
Aye.
The contrary, no.
No.
I think the noes have it. Division.
No. Aye.
Division, yeah.
You're making this work for me, Mr. Chairman.
Catherine Atkinson. No. David Baines.
No.
Matt Bishop.
No.
Ellie Chowns.
No vote.
Lizzie Collins.
No.
Emma Foodie.
No.
Vicky Foxcroft.
No.
Tom Hayes.
No.
Damien Hines.
Aye.
Catherine McKinnell.
No.
Amanda Martin.
No.
Stephen Morgan.
No.
Neil O'Brien.
Aye.
Darren Paffey. No. Ian Solomon.
Aye.
Patrick Spencer.
Aye.
Manira Wilson.
So the ayes were 5 and the noes were 11, so the noes have it, and lock. We now come to Government Amendment 3 to Clause 3, which has already been debated. With the leave of the committee, I will put the question on Government Amendments 3, 4 and 5, which have already been debated together. Minister to move formally. Government Amendments 3, 4 and 5 proposed to Clause 3. The question is, the amendment be made? As many of that opinion say aye.
Aye.
Contrary, no. The ayes have it, We now come to the question that Clause 3 as amended stand part of the bill, which has already been debated. The question is that Clause 3 as amended stand part of the bill. As many of that opinion say aye.
Aye.
Contrary, no. The ayes have it, We now come to Amendment 20 to Clause 4, with which it will be convenient to debate Amendment 21, and I call Neil O'Brien to move Amendment 20.
Thank you, Mr. Chairman. The first thing to say about Clause 4 is that we are extremely supportive of the principle here about consistent identifiers. Indeed, this is something we were working to deliver when I was in government, and I remember being in meetings about it when I was at the Department of Health, discussing, for example, whether it would be possible to use the NHS number as the identifier. So we are really keen that this happens. We've seen far too many young people fall through the cracks because of inconsistent identification, meaning that problems are not connected and dots are not joined up. So you won't always hear me say this, but this is a very good and important idea which we're completely supportive of. So our amendments here are really some tweaks to ensure that this can work as well as it possibly can, and I'll also ask some questions that I don't have an amendment with them, but I hope that the government will take away and have a think about so this can work as well as possible. So looking at our Amendment 20, now I understand the sort of safety valve, as it were, in Clause 4, subsection 3, and why it is there. But I am still a bit wary. In practice, how can a single agency take the decision not to share information until it knows what other information its partner agencies hold about the same case and the same person? Surely there needs to be a level of trust and strong information sharing protocols to allow the sharing to happen. Otherwise, for example, to give you an example, you might have concerns about a child who's got delayed speech at school, but without knowing that the mother has suffered years of abuse, been to A&E and never called the police. Without knowing those things, it's difficult to judge the situation accurately. So I just wonder about what the Minister's answer is to this concern about that sort of safety valve, as it were. One part of the answer, I hope, can be our amendment. That's what it's there for. Where information disclosure is not carried out because of a risk of detriment, something pretty serious is obviously happening. And that information itself, that there has been deliberate, conscious non-disclosure, is very important information. And it's information that we can potentially learn from. It's certainly something that we don't just want to see disappear into the ether and be lost. That's totally against the spirit of what we're all trying to do here. So our suggestion is that a conscious decision not to disclose for this reason is clearly recorded. Firstly, so that there is no confusion later about what happened and whether it was a conscious choice not to disclose or just inaction or error. Looking at our amendment 21, our new suggested subsection 6a, it just encourages those involved in taking such decisions just to take a moment to consider not just the welfare of the person whose information is being disclosed, but those around them to whom it may relate or involve, and to think about their welfare too. The person whose confidential information is being shared is not necessarily the only one whose welfare is going to be affected by that. Now, more generally on this clause, I'm happy to give way.
On that point, regarding, thank you, Chair, regarding this amendment, your proposal seems to have two parts. On the one hand, to require the consideration of the welfare of others to whom the information may relate, which seems quite a reasonable requirement, but the requirement to take steps to promote the welfare of potentially anybody to whom the information may relate seems to me a very broad requirement.
Thank you, the Honourable Lady, for a very thoughtful question. I mean, it is a very general point that you take steps to think about their welfare. You're not asking people to move mountains or work miracles or anything like that, but I can't think of a clearer way of... We don't want them to just think about it, but to act on that as well. And obviously there's two different amendments here. I also have a question, this is a question that doesn't have an amendment on it, about subsection 9 on page 8. This is on line 7 if members want to look at it. It is a bit of a tortured construction, and you can see the different principles that are in play here as it's been constructed. But I might find it a bit hard to pass if I were a frontline social worker, and I certainly find it hard to pass as an MP. It's sort of, I could see the lawyers in action almost. You're trying to say two things. It's like, don't be scared of data protection legislation, share important information, look after the welfare of children, and then other lawyers effectively saying, but obviously don't break data protection legislation. So it's a sort of, you end up with this slightly complicated sentence, and I think what it is trying to do is really to prioritise reassurance for professionals about data protection laws, because we have seen some quite scary cases where people have been so busy complying with data protection they've not used their common sense to do things that have been extremely important. So it's wonderful ministers to ponder rather than something we'll attempt to amend now, because it is obviously a complex world, data protection law. But I just wondered if ministers might want to look at it and turn it around to just put the onus on the principle that you've got to think first about safety and not be too scared off by over-enthusiastic interpretations of complex data protection law. I also want to, Mr. Chairman, press ministers a little bit on subsection 7. And once again, I sort of get why this safety valve is here. We mustn't, as I've been arguing earlier, we mustn't undermine the need for speed to protect people. But a bit like with our amendment that we would like to record decisions, not to share information in order to learn from such decisions, I wonder whether ministers, as the bill progresses, might not decide and think that it would be sensible to have some way of recording when the identifier is not used because people don't know it or can't find it in time. And particularly in the early years of this new system, complex system, difficult to get right, particularly in the early years of this new system, understanding how well the system is working or not will be really important for improving it. And something like that would also enable us to record in each individual instance whether an identifier is not being used, just like with our amendment, in error, or instead consciously because someone can't find it and doesn't think they need to find it, or can't find it in a timely way. So we will bring an amendment today, but ministers might want to think as they take it through all the Parliament whether there is something to do there I can see why you're creating the safety valve. Like, if you can't find it in time, just do the right thing to keep kids safe. But recording when that's not happening, because it's quite a big, is it kind of antithetical to the spirit of what we're trying to do here? If people would just routinely start not using it, that takes us back to square one in a sense. And I have similar questions about subsections 5 and 6 at page 7, line 34. They feel like quite a big dilution of the single identifier principle in relation to subsection 5, for example. How is a person to know in advance if a decision to use the identifier will facilitate safeguarding, or failing to do so will harm it? In relation to subsection 6, again, how does someone judge if sharing information would make a child less safe unless one has a fuller picture from other safeguarding partners in the first place? So it may be that there is no way to improve on this, and I remember how difficult all this is from working on it. But I just want to encourage ministers to think as they take this through about how the system launches and how we make sure that things don't just disappear into black holes, but if the system is not being fully operational for various conscious reasons, we understand that, or if it's just not being used properly, we understand that too. So finally, Mr. Chairman, some just very specific information questions. I note that the government plans to trial use of the NHS number as the single identifier, which is something I referred to earlier on. I don't have any objection to that. But can the Minister give the committee a bit more information on these pilots? What is the timing? How many will there be? Which places will be chosen? How will we choose places? I have a bit of a question about how we keep information up to date. So again, to give an example to bring this to life a bit. If a child's record is updated by the local authority to reflect the fact they are then in a foster family, and let's say the police note that in their files, but then the child returns to their family and the information on the police file isn't updated. So they go to their family address and the child isn't there and yada yada. How do we make this system work in a joined up way? How do we make sure that information is updated for everybody? Another informational thing, I remember it was always a challenge when we were thinking about this before. What consideration has the department given to children who might not have an NHS number, or indeed other numbers? For example, migrant children or people who are home educated, those kind of things. And this is quite specific. Up to what age will the identifier be used, and will that be consistent across all agencies? Are we talking 18 for everybody, 21 for everybody? We've been talking earlier on in the session about sort of continuing care levers and things like that. So finally, I must just press the Minister a bit on when this is going to be implemented. It's not at all an easy thing to do. It's a big undertaking, as the Minister knows. DFE's explainer on the bill, the notes say that specifying the agencies that must use the consistent identifier by regulations means that agencies will only be required to use the number once they have the appropriate systems in place to make it an effective tool in supporting children and families. So where have we got to, really, I suppose is the question. Are agencies yet ready to use this? Which are more ready, which are less? If not, when do we roughly expect there to be? I think we're all consistent with it being done well and working and being safe. We all want these things to move as fast as possible. I'm not having a go at the Minister because I appreciate it's not an easy thing to do. But can the Minister put some sort of timeline on what she expects to happen when, and when the consistent identifier will get rolled out, particularly given that this is something that we all agree is just incredibly important?
Amendment 20 proposed to clause 4 as on the amendment paper. The question is the amendment be made.
I will withdraw the amendment.
But the Minister to reply, if you wish.
Unless the Minister is happy to accept
I'm
it.
happy to respond, and do appreciate the spirit in which the Honourable Gentleman has set out his questions in relation to this. So just to clarify, Amendment 20 would require the relevant person to record their decision to withhold information if they consider disclosing it to be more detrimental to the child than not disclosing it. And we absolutely agree practitioners should record the reasons for their information sharing decisions. However, it should be irrespective of the reason for sharing or not sharing particular information. And the current non-statutory guidance, information sharing guidance for practitioners and managers, issued by the Department of Education, it does cover this point, making it clear that practitioners should keep a record of their decisions, including their rationale. So rather than legislating on it, it is our intention to cover this within statutory guidance, which relevant persons would be required to have regard to in relation to these matters. I appreciate the Honourable Gentleman raised a range of other issues in relation to clause 4 more generally, but I will go on to deal with clause 4 stamp part and could respond to those questions as part of those deliberations.
So everyone contend the amendment to be withdrawn?
Withdrawn.
And the same applies to Amendment 21.
Withdrawn.
So we now come to Amendment 44 to clause 4, with which we will be coming into a debate Amendments 43 to 45. And I call Munira Wilson to move Amendment 44.
Thank you very much. It's a pleasure to serve under your chairmanship this afternoon, Sir Edward. I beg to move Amendment 44 in my name, and just for clarity, after some mix-ups this morning, for which I apologise, these are probing amendments which we're not seeking to push to a vote today, but to get on record some responses from ministers about how the single unique identifier will be used. Now, I think, as the Shadow Minister has pointed out, there is widespread agreement that this is, clause 4 is absolutely necessary and long overdue. Failure to share information effectively has been identified over many years as one of the key barriers to keeping children safe and providing the joined-up support to meet their needs, and indeed conducting research across the children's system. And Professor Jay's report on child sexual abuse, I'm afraid, brought this into stark relief, and the failure of the agencies across the system to share data. And in our evidence session on Tuesday, I think it was the Children's Commissioner cited the same example that actually Professor Jay gave me when I met her last week, of teenagers in a particular area who had a very high prevalence of STDs, and that data was not shared with relevant agencies, because clearly that should have put up a red flag. So strongly welcome this clause, and I also want to pay tribute to the Children's Charities Coalition, who have done a lot of work and research in this space. Amendment 44 in my name seeks to expand the criteria requiring a designated person to use the consistent identifier in the information they process. As the bill stands, it requires consideration to be taken of safeguarding and promoting the welfare of the child, and these are absolutely vital criteria, as we've all said, but they could just be interpreted as relating to acute risk. And so very specifically, I want to insert the word well-being into the bill, which would seek to ensure the broader needs of the child were taken into account when considering the provision of joined-up support across the children's system. So I welcome when the Minister gets to her feet if she could explain why the use of the consistent identifier has been limited only to safeguarding and welfare in the bill, and how broadly does she envisage that being defined. For instance, would sharing information about a disabled child with health and educational needs but no social care needs fall into this category? Could she also indicate an indicative timeline for when local services will be required to start using the consistent identifier within their systems? Amendment 43 just seeks to provide some clarity where we think there may be a bit of ambiguity on the face of the bill, just to ensure that all babies, children and young people are assigned a consistent identifier, regardless of whether they've been identified with any safeguarding or welfare concerns. I think that's the intent of the bill, but this amendment just seeks to clarify that. And we know for years professionals, charities and commissioners have called for this, and we need this across all our systems to be able to manage all the interactions between the different services and to share data, to share information efficiently and securely. So if she could just confirm that point, I'd be grateful. And Amendment 45 would enable the use of a consistent identifier for research and commissioning purposes. Now the subsection where we are deleting appears to explicitly exclude the use of anonymised cohort data for these purposes, and this probing amendment is really seeking to question why that's being ruled out. Now, I recognise, and I and many others have had always raised concerns about data sharing in terms of making sure that it's done so safely and in an appropriate way. But I know, and having worked for a brief period in an organisation that used to be known as NHS Digital, I used to walk around with a lapel badge that said data saves lives, and data absolutely does save lives, and it's so important for safety, but also for research and commissioning purposes. And so if data is de-identified and shared safely, we can use that data on certain cohorts of children who are at risk of poor outcomes, such as children with SEND, looked after children, or children missing from education. It would allow commissioners and researchers to analyse their needs, risk factors and outcomes across different services, providing a much more complete picture of children and young people's needs and identify gaps in provision and interventions that could be used. So, and it would also support the development of new qualitative indicators to measure impact. So I'd welcome the Minister's comments on the government's rationale for specifically not allowing this in the bill. And just one final comment I'd like to make on the use of the single unique identifier. I mean, this is only going to work if there is investment in the systems to be able to share that data. And I know from talking to my own local authority that too often that the barrier to sharing information is not, sometimes it is an unwillingness between agencies to share information, but sometimes it's just the systems cannot talk to each other. And we've got the technology there now to be able to do this. So in order to implement this and use the single unique identifier to the best effect, we have got to provide the agencies with the means to be able to share that information for the safety, the welfare and also the well-being of our children and young people. Thank you, Chair.
Amendment 44 proposed to clause 4 as on the amendment. Paper, the question is the amendment be made. Minister.
Thank you, Chair, and I will now address amendments 44, 43 and 45 from the Honourable Member for Twickenham, and appreciate the spirit in which they have been proposed as probing amendments. So turning first to Amendment 43, which would provide the Secretary of State with the power to make regulations providing that each designated person must attach a consistent identifier to the records of every child without being limited by a particular purpose. I absolutely share the member's desire to ensure as many children as possible are able to benefit from a consistent identifier. We are very conscious of the need to ensure the identifier has complete coverage from birth to 18. In terms of timelines, I appreciate the urgency with which members wish to see this come into play. Obviously it's not yet legislated for. We very much hope it will be. But we are piloting the use of the NHS number, which is assigned to all UK-born children at birth, or when contacting the NHS for children born outside of the UK, and as such deem it to be universal. The exact services and systems and data shares that store and move the number will have to be developed during that piloting. Regulations will stipulate the agencies that must use the number when recording and sharing information for the purposes of safeguarding and promoting the welfare of children. I will give a little bit more information about the timeline of the pilot and intentions in terms of implementation in response to when I move the clause stamp part, because I'm conscious that the opposition spokesperson also raised those concerns. Turning now to Amendment 44, which seeks to amend the scope of the duty by including a reference to promoting the well-being of children. The legislation will enable statutory guidance to be issued, which relevant agencies must then have regard to. So that will outline the type of information that may be relevant to safeguarding and promoting the welfare of children, including information that relates to their well-being, so practitioners are able to more easily apply the legislation in practice. It has been very much defined to sit sort of coexistent with other child social care legislation and the framing of it. So indeed welfare would cover the well-being of the child within that. So turning to Amendment 45, which looks to remove the stipulation that a consistent identifier must be used when it is likely to facilitate safeguarding and promoting the welfare of children directly. I do appreciate the Honourable Member's concern that it limits the use of the consistent identifier, and in particular for research purposes. And I know that stakeholders have been calling for that. These measures make provision for the Secretary of State to specify which agencies must use a consistent identifier, and when it's introduced, it's intended that it will be used, it could still be used for research purposes if it's authorised to do so in accordance with UK GDPR and the Data Protection Act. So we've purposefully prioritised linking use of the consistent identifier with safeguarding and welfare functions, and we'll be testing the benefits and implementation of this through our pilot. But if additional benefits are realised, we can obviously look to explore the provisions further. So for the reasons I've outlined, I do hope that the Honourable Lady will be happy to withdraw her amendments.
You wish to withdraw your amendment?
I wish to withdraw.
Okay, so amendment by Leave withdrawn. That disposes of 43 and 45. So we now come to the question that Clause 4 stand part of the bill, and the question is that Clause 4 stand part of the bill. Damien Hines? Oh, sorry, I think I've got to call the Minister first. Is that right? Yeah, sorry.
Thank you, Chair. So Clause 4 seeks to address long-standing issues that hinder information sharing to improve the safeguarding and welfare of children, stopping families and children falling through the cracks of public services. Whilst current legislation permits information sharing to safeguard and protect the well-being of children, user research has identified that practitioners often only feel confident where there are serious child protection concerns. And as a result, information is often held by different agencies and practitioners, and they're left unaware of crucial data which could provide evidence of a whole picture of a child's well-being, of their health, or indeed their safety. The gap in knowledge can make it difficult for professionals to support families, and they make it harder for families to be aware of their entitlements and access the support that they need. So Clause 4 will give professionals a clear legal basis to request and share information with other relevant professionals for the purposes of safeguarding or promoting the welfare of a child. The clause also enables the Secretary of State via regulations to specify a consistent identifier for children. Agencies specified in regulations will be required to use the number when recording or sharing information about a child for safeguarding or the promotion of welfare purposes. And these measures aim to ensure practitioners share relevant information confidently and consistently. As I mentioned, the Department will pilot the implementation of the consistent identifier and introduce it nationally at a later point. We'll be testing its ability to facilitate the linking of data together across data sets. This clause, along with the legislative changes, aim to ensure that information about a child and their family is shared effectively and the risk is correctly identified and understood. And in response to the specific questions raised by the Honourable Member for Harborough, Oadby and Wigston, it is a two-way duty to share information. The duty, along with the consistent identifier, will help to bring together multiple pieces of information so that practitioners can make informed decisions. And as I said, it is standard practice to record decision-making regardless of whether information is shared or not, and we will make sure this is covered in the guidance. And we are committed to implementing the consistent identifier just as soon as possible, but we recognise it has to be delivered proportionately and where it has an impact. And before mandating its use by certain agencies, we need to explore the information governance, privacy, technology choices and associated costs of the implementation and of its use. So we're committed to starting pilot activity from April 2025, subject to this bill being passed. We will provide further timings once the pilot findings are known. And in response to the Honourable Lady, the member for Twickenham, a disabled child would likely be considered a child in need and so would benefit from the information sharing duty and a single unique identifier. And we absolutely know that we need to ensure that systems can talk together, and that is why we're piloting, so that we can see the full cost and the needs of how this can be put in place to make sure it is effective as possible to support children. So I beg to move that on the basis of the debate we've had today, the reassurances and the significant difference this will make to the safeguarding of children, that clause 4 is adopted by the House.
Thank you very much, Sir Edward. And I rise in support of this clause for all the compelling reasons that the Minister gave in her rationale. We were talking earlier about multi-agency working and its value, and the sharing of information is fundamental to that. And too many times in the past, as she outlined, there have been cases where, for want of a way of identifying that it is the same child that two different agencies are talking about, that has been at the heart of the problems, and the unique identifier will help to address that. These are never things that we are likely to disagree on party political lines. I do, though, think there are some quite big questions attached to this, and I hope she'll take these in the spirit in which I mean them. The first, and this may sound like a semantic question, but I think it's quite an important one. On page 6, line 19, in the phrase duty to share, so I'm conscious that the word share can mean different things, and its common English usage has probably changed somewhat over the last 20 years or so. So share used to commonly mean something held in common between two parties. More recently, and it's a lot to do with social media and the internet, it's come to mean pass something on to a wider group, and they are different things. I think here we are using share more in the sense, in this title, more in the sense of disclosure than holding in common. But I'd be really grateful to get some clarification on that, because although it is, in a sense, a semantic question, this will be primary legislation created by Parliament, and therefore that decision, I think, is important. And what is the link, or what's the overlap with mandatory reporting? Is this what we're talking about today? Is this exactly the same thing as mandatory reporting, or something different? The existing statutory guidance on safeguarding says that anyone who has concerns about a child's welfare should consider whether a referral needs to be made to local authority children's social care, and should do so immediately if there's a concern that the child is suffering significant harm or is likely to do so. It's not a legislative requirement, therefore, to report abuse, but there is the expectation created that if you're working with children, you will do that unless there are truly exceptional circumstances. And of course, some people in particular roles also have additional codes of conduct set by their professional regulatory body. The independent inquiry into child sexual abuse of 2022, of course, put forward the mandatory duty, and to be clear again, I support that. And under the previous government, in 2023, the government committed to introduce a mandatory duty to report sexual abuse for those working or volunteering with children. Of course, the Criminal Justice Bill then fell with the dissolution of Parliament just before the election. But with mandatory reporting of sexual abuse, and the same principle, you could say, applies more generally to neglect and other forms of child abuse, that historically people have also identified problems with having a mandatory duty, and not just people in government, but one very leading children's charity for a very long time had a stance against having mandatory reporting because of the effect it might have on the relationship between a child and a trusted adult, and their willingness to open up to that adult because of what that might then trigger. I'm sure the government have been through this in a great deal of detail. It's obviously a very serious and difficult area, but I wonder if she might be in a position to say a little more on that. In terms of the practicalities here of sharing information, and again, it sort of slightly comes back to this the semantic question. So on page 6, line 24 and 25, when we say that the relevant person considers that the information is relevant to safeguarding or promoting the welfare of the child, there's a question about whether we're talking about disclosing a particular piece of information, which we think is directly and specifically relevant to an individual child, an incident that's happened, an observation that a social worker, or in this case a teacher, may have had with eyes on that child. Or do we mean more generally that a data set that we hold about children in the local authority area, the particular indicator that we know about all of those children, that is relevant to the question of safeguarding for all of those children, and therefore the entire data set is shared with other agencies. Assuming it's the former, and my honourable friends already talked about this, on page 7, lines 11 to 15, I do think there really could be a difficulty here in terms of the balance. So that part of the text as a duty under this section to disclose information does not operate to require or authorise the disclosure of information which would contravene the data protection legislation. But we all know that often when people say, well, such and such wasn't disclosed, wasn't shared with another agency, the reason given is data protection. So I don't necessarily have the answer for how the government does this, but I think creating some, to the extent it's possible, creating some clarity to understand what that balance is, I think would be very helpful. And in the section which my own friend also referred to, lines 31 to 33, on the previous page, this question about not applying it if the person considers the disclosure would be more detrimental to the child than not disclosing it. Again, that is, I think, very difficult for any individual. And I think from the point of view of being inside one agency, in this case being inside school, being able to make a judgment without knowing what the police may know or social workers may know, I think is very difficult. But this does give the legal basis, and I think that is helpful. It also generally raises a question about what is the threshold. So we talk about a child being at risk. Obviously there are degrees of risk, and we also know, sadly and sometimes tragically, that these things can quickly escalate. And again, it's not, I think, totally clear, and it probably never can be clear on the face of a bill, an act of Parliament, at exactly what sort of stage in what might be a deterioration for that child, at what point does the duty kick in. But I think these are questions the government is going to have to come back to. Now, of course, as I said earlier, being able to share in whichever of the two senses information is dependent to a large extent on there being a unique identifier. And again, I very much support this, and again, it builds on work that was underway before July of last year. But I think there are some big issues that government, and I say government, not just the DFE, I think these issues actually go beyond the bounds of the DFE, big issues the government are going to have to think about. In other applications, we've talked in the past about what you could use the national insurance number for, on the grounds that, well, every adult has a national insurance number. Of course, when you try to actually do it, it turns out that the database of national insurance numbers is not quite as perfect as everybody assumed. And the National Health Service number wasn't designed for this purpose. So what testing of that system, what stress testing have the government done? Historically, of course, up until very recently, most NHS records were paper-based, and that creates a very different set of governance issues than with the databases we have today. And the Honourable Lady from Twickenham spoke, I thought it was a very important question about to what extent these data would be available for anonymised cohorts analysis. In another part of government, there's conversations going on at the moment about the use of NHS data sets en masse to empower AI. Now, with this cohort of children, my God, that raises some very important, and not conclusive, because there are arguments both ways, but really, really important arguments about morality and so on. And is this going to be a database residing inside the NHS system, or is it something new which uses the NHS number? If it's something new, of course, there are budgetary requirements. That would be a very, very large new IT project with very demanding security requirements. And there's other questions about how, for example, you interface with the police national computer or other security-related databases. Now, I think it is largely possible to guarantee that the same NHS number doesn't go to two different individuals. But I'm not 100% sure it's possible to guarantee that the same individual doesn't get two different NHS numbers at different times, because there are different points at which you may receive an NHS number. At birth, of course, is the time when ordinarily it happens, but also on immigration or at a moment of first treatment. Of course, sometimes at the moment of first treatment, that isn't, getting an NHS number is not going to be high on the minds of families. And of course, the NHS will not refuse to treat somebody in those circumstances, so there could be issues there. But particularly if a child has perhaps been born abroad, has moved here, has re-emigrated and re-immigrated, I think there are circumstances in which you can imagine that the same child could have two different numbers. And I just wonder, by the way, for the avoidance of doubt, I'm not expecting the Honourable Lady to be able to come up with answers to all of these questions now. I suppose the point I'm making is these are big, big questions. And I think the government are going to have to come back and back and back about some of the implications. Some of the wider ones are, look, once you've got a database like this, if we're talking about a database of every child in the country, there are then a lot of other things you could do with that database, some of which could be very useful. We're debating elsewhere about online safety, for example. Age verification, trying to protect children from material they shouldn't see. You could use this kind of identifying term for that purpose, and there might be some benefits to that. But boy, does it also throw up a lot of questions in a country where historically we have not had a single list of every child in the country. My honourable friend also alluded to the question of, well, if you had an NHS number, unique identifying number when you were born, and you would still have when you were 12, you'd still have when you were 17, hang on, you still have when you're 18. So what's the implication of the existence of this database for adults? And again, there could be, this isn't the place to have that debate. There could be some great advantages, but there could also be disadvantages. There's certainly going to be privacy questions, and again, in a country which has had a debate about identity cards multiple times and has ended up being incredibly complex. The big question is what you can use this unique identifier for as an index term to interface and therefore to link with other databases. And for child protection, if you can't, it isn't really, to be honest, it's not worth that much. You have to be able to link them all together. But both for children and potentially for adults, if these numbers stay with people as they turn 18, that raises some difficult questions. So I think ultimately some of this governance stuff covers not only DFE, it covers DHSC, it covers the Cabinet Office. I'd love to know, even at this stage, what involvement the Information Commissioner's Office is having and what involvement they will have in the future.
Thank you, Mr. Chairman. You've already asked most of the questions. I just want to add a tiny amount to them. Very simple questions. Just so I'm clear, I may have missed this in the conversation, but this is a system, question to the Minister, for people of up to age 18. Is that the intent? That's one question. The second question is just initial thoughts on the people who don't have NHS numbers and where the government's thinking has got to on them. And third, just to sort of sharpen and bring out the point that I was making in my questions about all these different get-outs from the system. So the worry here is we've seen all these people, Victoria Clinton, the ultimate example, with 8 different identifiers and her name spelled differently every single time. So the system needs to not have too many holes in it. It needs some, so otherwise everything will grind to a halt. So subsection 5 at the bottom of page 7. So this applies only insofar as the designated person considers the inclusion of the identifier is likely to facilitate the exercise of safeguarding. That's one out. It doesn't apply if the designated person considers that it would be detrimental to include it. Another out. Perfectly sensible in a way. The next one is doesn't need to comply if the person doesn't know the consistent identifier and it would slow things down. So there's just quite a lot of outs. And I think that the Minister, although we are pushing our amendment today, she's right to say that the statutory guidance requires you to record why you made decisions at the local level, but I'm sure that the department and officials will want to set things up in such a way that you can build a national report out of that data and figure out what is going on at the local level. And there's a very final point, because I didn't read it out before, just to explain what I was going on about the complexity of parsing subsection 9 on page 8, top of page 8. A duty under this section does not operate to require or authorise the processing of information which would contravene the data protection legislation, brackets, but the duty must be taken into account in determining whether the processing would contravene that legislation. It's just quite a complicated sentence. I would find it difficult, I do find it difficult, and I encourage ministers to be very supportive if they want to give frontline professionals more legal protection so they feel, I don't need to worry about data protection first, I need to worry about safety of children first.
Does the Minister wish to say anything more? Is that it?
Well, I'm happy to respond to some of the
Please, if you wish.
observations that have been made. And I totally accept the comments have all been made very much with a view to making sure that this legislation can be as effective as it needs to be, and that we all share the desire to ensure that this does serve to safeguard children. With regards to the Right Honourable Gentleman's question for East Hampshire on whether this is the same as mandatory reporting, the information sharing duty under this new clause and the mandatory reporting are intended to address different problems. The information sharing duty underpins how existing multi-agency partners, along with schools and early years, can both share, and I appreciate his philosophical reflection on the word share, but it is very much a sharing of the parts of information and can request information as well between themselves so that they can build that full picture of a child, and then they can use that to assess risk and put in place appropriate support and intervention. Mandatory reporting of child sexual abuse, which is due to be introduced as part of the Home Office legislation, that imposes a duty on professionals to report instances of child sexual abuse, along with criminal sanctions on those who prevent others from reporting abuse. So they do have different purposes and different legislative frameworks. With regard to your considerations of the terminology that has been used in terms of share, the sharing of information in this context does cover the exchange of knowledge, data or insights with others, and it can happen in a number of ways. And specifically on this question of whether the information about an individual child or data sets is relevant, we do intend this to be about the individual children being able to be supported on a day-to-day basis to ensure their safeguarding and make sure that they are getting the support they need and that their families are too. But the Right Honourable Gentleman very thoughtfully raised a whole range of important questions that he very kindly acknowledged I would not be able to respond to here, but we will take them away and work them through, and it will very much feed into how we pilot this in order to make sure that we get this right and to test the system, which quite rightly he has highlighted. And then on the, including on the single unique identifier and the NHS system, and just to say it will apply to children up to the age of 18, and on his question on what would happen to a child without an NHS number, again, that will have to be considered as part of the pilot, and why we're undertaking a pilot, because this is an important change, but we don't underestimate the challenges in delivering it, but we are determined that it will make the difference to children and safeguarding. So I beg to move.
So the question is that clause 4 stand part of the bill. As many of that opinion say aye. Aye. Contrary no. The ayes have it. The ayes have it. We now come to Amendment 38 to clause 5, with which it will be convenient to debate Amendments 22 and 39, and clause 5 stand part. I call Munira Wilson to move Amendment 38.
Thank you very much, Chair. I beg to move Amendment 38 in my name. I strongly welcome clause 5 and delighted that we are finally securing a definition of kinship in statute and requiring all local authorities to publish their kinship offer. This is long overdue and is absolute testament to the tireless campaigning of many groups in this space, not least the Family Rights Group and the kinship carer community and young people. And the Honourable Lady, the Minister, may remember that, excuse me, back in 2022 I introduced a 10-minute rule bill which sought to put a definition into law of kinship and a number of other provisions which we'll come to in the new clauses at a later stage of this committee. But starting firstly with Amendment 38, this amendment seeks to add to the list of services that we believe should be included to assist children and their kinship carers in terms of the local offer that local authorities are being required to publish. So it adds financial support, legal support and family group decision making to the list of items that should be included in the offer. The ministers are aware that kinship carers turn their lives upside down to take children in, even though their own financial situation may be unstable. And around half of kinship carers are grandparents relying on their pension savings. We know that financial support across the country is variable, which is why, once again, in a new clause later on, I'll be seeking to address that variability and ensure that there is parity of allowances across the country. But for now, as that's not included in the bill, and I suspect ministers won't be able to accept that because of Treasury constraints, I think at the very least, whatever financial support is available at a local offer, that information should be included in the local offer. We are also very concerned by the omission of both information on legal support and family group decision making from this list. These categories already appear in statutory guidance but are not on the face of the bill here in clause 5. Now we've just looked at clause 1 on family group decision making, so I'm not entirely sure why it was left out of this list, and I look forward to the Minister's comments on why that is. The child welfare and justice system is extremely complex. Early specialist advice, including legal advice, has a crucial role to play in helping families navigate that system, understand their rights and responsibilities, and avert children from care. And having had many a meeting with kinship carers, one of the things, apart from financial support and leave and all of those things that would make their lives easier, time and again I hear the point made that I just didn't know what my rights were, and the local authority was telling me one thing and I had no information to push back, because sometimes local authorities are seeking to make kinship carers do things they may not necessarily want to do, or not necessarily lay out all the options. And so legal advice is so important, and it is also very expensive. The APPG on kinship care legal aid inquiry found that many families just don't have access to legal advice to make informed decisions about their kinship arrangements, something which we know has lasting consequences for their entitlement to support, and who can make key decisions about the child. 82% of kinship carers surveyed felt they did not know enough about their legal options to make an informed decision about the best options for their kinship child. So I would implore ministers to accept this amendment and include that information in the bill as part of the local offer. Now, Amendment 39, which I think is relatively similar to Amendment 22 in the official opposition name to some extent anyway, seeks to ensure the involvement of children, kinship carers and others in the development of kinship local offers, as well as ensuring there is transparency and publication of comments on those offers and the feedback that local authorities receive from children, kinship carers and others with lived experience, because they will be able, they're best placed to comment on how things could work better, and making sure there's transparency of that feedback we believe is really, really important. At the moment, we think there are low expectations in this bill on the involvement of those who are involved in kinship care, and this contrasts with the SEN and disability local offer, for example, which is established in Section 30 of the 2014 Children and Families Act. And so Amendment 39 would be consistent with that piece of legislation around special educational needs and disability. And it would also give the Secretary of State explicit powers to set out in regulations how that offer should be published, when it should be reviewed, and how children and families are involved in developing it. Finally, just more broadly on Clause 5, I think it would be advantageous, I don't have an amendment on this, but I'm keen to hear the Minister's thoughts on this, if she could clarify on parliamentary record what the definition of other person connected is on page 9, line 40. The bill defines kinship care as when a child lives with a relative, friend or other person connected with the child for all or part of the time. Now, the term relative in the bill has the meaning given in section 105 of the Children Act 1989, namely a grandparent, brother, sister, uncle or aunt, whether of the full blood or half blood or by marriage or civil partnership, or a step-parent. It omits extended family members such as cousins. Now, given that we know that there is that kinship care arrangements are particularly prevalent amongst a number of ethnic minority communities where culturally actually it is much more normal for extended families to live together, cousins may well be involved in those arrangements. Now, I understand that the department has confirmed that such wider family members are intended to be captured by the phrase other person connected to the child, but nowhere in the bill is the term other person connected defined, and nor has there been any indication as yet that regulations or statutory guidance will make plain who falls within the scope of that phrase, and I think clarity would be important for families and practitioners. So I welcome the Minister's comments on that and the other issues I've laid out in those amendments. Thank you, Chair.
Right, Amendment 38 proposed to Clause 5 as on the amendment paper. The question is that the amendment be made, and I see nobody else standing, so the Minister may wish to respond.
So I rise to speak to the amendments to this. Amendment 38, I was just checking whether I'm speaking to clause stand part also. I believe I am in this group.
I would speak to 22.
That's what I'm thinking. Yeah, do we have more amendments to come? Or
Yes.
Yeah, it's 22.
You've got Amendment 38, Amendment 22, 39.
And are they not in
You can say Clause 5, you can say whatever you like.
Well, shall I hear the amendment first?
What you wish to have.
I'd like to move my amendment at this point. Sorry, not to move my, to speak to my amendment at this point.
You want to speak to your amendment?
Yes,
Okay, well, should we do that then? Okay, sorry, you weren't standing with us.
So many apologies, Mr. Chairman. So I rise now to speak to Clause 5 and our amendment 22. And again, on kinship care generally, this is something the last government was promoting. There is no great disagreement about this. In fact, there is great agreement, and indeed the Honourable Lady from Twickenham as well, and I pay tribute to her work on this too, and she is right that her Amendment 39 is very, very similar to our Amendment 22. Creating a duty for a local authority to publish a kinship care offer, a local offer, seems very sensible to provide clarity and ensure that kinship families are aware of what support is available as well. And the statutory guidance on kinship care that already exists says every local authority must publish information about services they offer in their area to children in kinship care, their approach towards meeting the needs for those children. And that's been there since 2011, but too many of them still don't have an up-to-date offer, so we're very supportive of this. And this is an example where the government is building on the direction of travel under the last government. Kinship care strategy we published in December 2023 set out a definition of kinship care that's been used in the updated statutory guidance on kinship care published by this government in October. Now, one reason for having something that is public and visible for everyone is important, is that many people, when they hear kinship care, will think of uncles and aunts and grannies. But of course, a lot of kinship carers are not related to the child. There's about 140,000 children living in kinship care, but there's a further 24,000 children living with kinship carers that they are not related to, family friends. And now, the Minister will be aware of concerns from kinship carers in the organisations like the Family Rights Group who represent them. So the definition of kinship care in the bill, that's 5 on page 221 and page 9 and 10, risk providing less clarity and potentially greater confusion for children, families, practitioners and agencies. And they argue that they don't adequately address the different types of kinship care arrangements, and the expectations for councils to involve families in shaping their promoting their local offer are minimal. And I wonder what the Minister's response to that would be and what she plans to do about that. And the Family Rights Group raise a really specific point as well, which they say should be amended in the bill. And they say, and I quote, The bill includes a list of categories of service available in the authorities area that the kinship offer, local offer, should include. We are very concerned by the omission of legal support and family group decision making from this list. These categories already appear in statutory guidance but not in the bill. So the Family Rights Group proposed an amendment to remedy this. We aren't bringing that amendment today, but will the government at least consider taking that up? Family Rights Group also make another point. They say, we are concerned that the bill sets low expectations regarding the involvement of children, kinship carers and others in the development of kinship for local office, as well as in respect of publication and transparency. And this is in contrast to the SEN and disability local offer established in Section 30 of the 2014 Children and Families Act. That legislation gives the Secretary of State the power to set out in regulations how the offer should be published, when it should be reviewed, and, this is the key bit, and how children and families are involved in developing it. And that's what takes us to our Amendment 22. Once again, just like previous ones we put down, our amendment seeks to set in train a self-improving system by collecting feedback from children in kinship care. We've heard already several times during these sessions about the importance of the voice of the child and the voices of those who are providing care, and this is just a way of ensuring that we hear them. It is a very light touch process that we're proposing with this amendment, keeping a record of feedback. Firstly, it helps to protect from the loss of knowledge when personnel inevitably change, so we have that feedback and knowledge. It also provides a resource for learning and performance improvement at the local level, and by publishing it, as we suggest in the amendment, we also allow for a better public discussion and also allow for learning at the national level too. So that is the purpose of our amendment. We don't have a great disagreement with the spirit of this clause, quite the opposite in fact, and we hope that the Minister will adopt or in some way implement the ideas in our amendment.
Minister.
Thank you. So I rise to speak to the amendments in Group 8 and also clause stamp part number 5. In relation to Amendment 38, in the name of the Honourable Member for Twickenham, I appreciate the Honourable Member's engagement and great interest in the kinship local offer, and to explain how we see it working, we would expect that local authorities would include information on legal support when setting out their general approach to supporting children living in kinship care and kinship carers under the newly inserted Section 22H1A listed under Clause 5. And to be clear though, the listed categories of information about services have been kept very broad by design to cover as many different kinds of services as possible. It means local authorities could reasonably be expected to provide information about legal support under one of the categories we have included. Clause 1 already sets out the requirement to offer family group decision making at pre-proceedings, and Section 22H1B requires local authorities to publish information about financial support which may be available to children living in kinship care and their carers. So I would like to give reassurance that the list of categories of information about services in the bill is deliberately not exhaustive. It also remains our intention that further detail on what we expect to be included in a kinship local offer will be made in statutory guidance. So we will take back and take on board the points that have been made in this debate today. We believe that amending Clause 5, as has been suggested, would not achieve this effect. We believe we have the measures in place that would deliver what the Honourable Lady is looking for, so we would kindly ask her to withdraw her amendment. In relation to Amendments 22 and 39, tabled by the Honourable Member for Harborough, Obi and Wigston and the Honourable Member for Twickenham, I do appreciate the concern about consulting children and carers on the kinship local offer and making sure their feedback is collected. The Children's Social Care National Framework and the existing kinship care statutory guidance make it clear that children's wishes and feelings should be taken into account whenever adults are trying to solve problems and making decisions about them. And local authorities are indeed legally obliged to adhere to Article 12 of the UN Convention on the Rights of the Child. That makes it very clear that the child has the right to express their views, their feelings and their wishes in all matters affecting them, and to have their views considered and taken seriously. The kinship care statutory guidance also sets the expectation that local authorities should consult children, kinship carers and parents as appropriate in drawing up their kinship local offers, and set out how the kinship local offers have been informed by their views to ensure that transparency. The new section 22H7 says that a local authority must review and update its kinship local offer from time to time to give opportunities for the views and opinions of children living in kinship care and their carers to be taken into account. However, since the intention of Clause 5 is to ensure that local authorities publish information about what their kinship local offer includes, what is published should be a clear reflection of the services available, and consultation on the publication would be of limited value. So we cannot be more specific about how kinship local offers are published, as it would potentially limit the accessibility of the information. So, for example, requiring online publication would potentially limit those who don't have access to that technology. So for that reason, Section 22H6 already puts an obligation on local authorities to take such steps as are reasonably practicable to ensure that children and kinship carers receive the information relevant to them. So we don't believe that the amendments are required, as there are sufficient safeguards within Clause 5 and other legal frameworks, and because the local authority will be the best placed to determine what information should be published, and more prescription in legislation may hinder local authorities from designing and publishing their local offer in a flexible way that reaches and makes the maximum impact. I wanted to respond to the question raised by the Honourable Lady, and I think to some extent by the Honourable Gentleman, in relation to some lack of clarity on the definitions of connected person. And just to be clear, it's because it is actually defined in the Children's Act 1989. The term relative is deliberately not defined in the bill because these measures on the kinship local offer are not freestanding. They do form part of the Children's Act 1989. So while Section 105 of the Children's Act defines relatives, Section 22H1A of the bill includes a relative friend or other person connected with the child, so it is broad enough to cover every type of person. So although cousins are not specifically defined as a relative, they would fall within the category of other person connected with the child. So I do hope that has answered all of the questions raised by honourable members, and would urge them to support this clause being included in the bill.
I'm just trying to see if I'm trying to get the honourable lady to give way. To see if I could ask her just on this very specific point raised by the family rights group. They effectively would like to add another item into the list that is at page 9, line 17, where it currently says the list of support services should include health, relationships, education, training, accommodation, and effectively what they would like to do is to add on legal support. Is this something that the Minister will go away and have a look at?
So, I mean, I appreciate the request. Obviously, I've dealt with that in my response, in that we feel that we've included broad headings that clearly are not exhaustive and leave the room for local authorities to very much publish the whole range of services that they feel will support kinship carers, because fundamentally we know that having a good kinship care offer is in the local authorities' best interest, because they are the ones supporting the children that they know need that care. But I'll certainly take away the honourable gentleman's specific consideration.
Would the Minister also give way on that point? And I fully agree that the list at Clause 5, subsection 2, is clearly not an exhaustive list, and many local authorities, as a matter of good practice, will be setting out the variety of services available to children who live in kinship care and kinship carers. But I would also invite the Minister to consider the guidance already available and any other means of encouraging local authorities to publish their approach in relation to legal support and ensure that these provisions remain under review.
I thank the Honourable Lady for her intervention, and it is noted.
So, Munira Wilson, do you wish to say anything now?
I think Minister for her response on this point about legal support, which of course is in Amendment 38, along with financial support and family group decision making. I had intended to push that to a vote, but given the Minister's assurances that it will be in statutory guidance, I'm happy to withdraw that and not push it to a vote. And on her point about connected persons, I think we just need some clarity because, as she says, relative is in the Children's Act 1989, but that doesn't cover cousins. And I think for those other arrangements, I think practitioners on the ground and families just would like clarity. So again, whether that's in guidance, I think it just needs to be spelt out further. But I'm happy to withdraw based on the assurances given by the Minister today.
So amendment by Lee withdrawn. Do you wish to withdraw your amendment?
Withdrawn.
So amendments 22 and 39 debated and withdrawn. We now come to the question that clause 5 stand part of the bill as many, which has of course been debated. The question is that clause 5 stand part of the bill. As many of our opinions say aye. Aye. Contrary no. The ayes have it. The ayes have it. We now come to the question that clause 6 stand part of the bill. The question is that clause 6 stand part of the bill, and the Minister, do you wish to move it?
Formally.
Formally. Neil O'Brien.
Thank you, Mr. Chairman. Now, we have no amendment down to clause 6, and this is another area where the government are building on the direction of travel under the last government. The role of the virtual school head was extended already on a non-statutory basis from September 2021 to include strategic oversight of the educational outcomes of children with a social worker in that local authority's area. And it's now, through this bill, being extended again to champion the education of children, including children in kinship care. Educational outcomes for children in need and children in care are still far too low, despite the efforts of successive governments over the last 40 years to improve them. About 1 in 5 children in need and indeed looked after children achieve grades 4 or above in English and Maths GCSEs, compared to 65% of all children, a huge gap. And as the Minister knows, local authorities have an existing duty to monitor child in need or Section 17 plans, and I believe that's about twice a year. Can she clarify, does this bill give us an opportunity to escalate that monitoring? And does it extend to children in kinship care where a child is falling behind or where their attendance drops sharply? Has the government considered extending priority school admissions for children in kinship care and making them eligible for Pupil Premium Plus? And also a bit of a question about how a single person can discharge this duty in any local authority, let alone a larger one. Again, think about Birmingham, think about Kent, think about Leeds or somewhere like that. What is the government's expectation of what the person responsible for delivering this work will be able to do?
Damien Hyde.
Thank you very much. Thank you very much, Sir Edward. And this clause, of course, extends the role of, in legislation, of virtual school heads to children in need, previously looked after children and children in kinship care. The virtual school and virtual school head concept are not new. The concept, I think, first piloted in 2006 in Liverpool, and it was the 2014 Children and Families Act, which we will both remember, Sir Edward, well, that required all local authorities to administer Pupil Premium Plus. The Oxford University report on the virtual school heads concept noted that there had been improvements in outcomes at Key Stage 2 and 4 for looked after children, and a particularly a marked decrease in expulsions, permanent exclusions, although, as my honourable friend, the Shadow Minister, rightly said, there is still a yawning gap in attainment and all manner of life outcomes questions for this group of children. Previously looked after children were added to the virtual school head cohort in 2018. There was a pilot to include children in need in 2021, and from 2023-4 onwards, Pupil Premium Plus was extended to age 16 plus. So once again, this is a policy area where there isn't a difference between us and the current government's work. Builds on previous government's work, and we welcome that. I think we also note the successes of the virtual school head concept. My question to the Minister is about the danger of dilution, because when you have a relatively small number of children, and in terms of orders of magnitude, there are 85,000 children in care, looked after children. There are 400,000 children in need, so it's a big It's a big increase in number. And I note that in clause 6, paragraph 4 in the bill, it's a strategic duty that's going to be put onto the virtual school heads. So not about individual children. And the bigger the number of children you get, of course, with that dilution effect, there is a risk that some of the benefits of the virtual school heads programme reduces. You can counter that to a degree by upping the resource. And so my real question is, what is going to go behind this in terms of resourcing to make sure that, that the maximum effect can be felt from virtual school heads? And as we were talking about earlier in relation to multi-agency working, of course, once again, it's the actual practice that matters. And so far in the statutory guidance, and there are good reasons for this, because people have been doing it different ways, and you can learn from what works in different places. But what work is there going to be to propagate best and most effective practice between places across the country?
Thank you, Chair. I very much welcome clause 6 and the extension of the virtual school head oversight role to children in kinship care. However, I was perplexed to see that the category of children this applies to is a subcategory of the definition we've just looked at in the previous clause. And I'm not quite sure why it is that the virtual school head isn't available to all children in kinship care and only those subject to a special guardianship or child arrangement order as set out in lines 29 to 35 as I understand it. So I would welcome the Minister's comments on that, because it seems to me, having just passed a definition of kinship care, we're immediately seeking to undermine it by extending provision of educational support, but only to a subset of the group that we've just agreed qualify as children in kinship care. And we're seeing the same with the rollout of the pilot in terms of allowances, that again, it's just very much a subset. And I think that undermines the value of having just agreed in law a definition of children in kinship care. We know that there are higher levels of special educational needs among children in kinship care compared to the wider population. So I think it's really important that the children who are eligible for this support is drawn as widely as possible. I also very much welcome the Shadow Minister's comments that he'd like to see Pupil Premium Plus and priority admissions extended to children in kinship care. And I hope this means he'll be supporting my new clause 28 and new clause 29 when we get to those new clauses towards the end of the committee stage. Thank you.
Thank you, Sir Edward. It's a pleasure to serve under your chairmanship. I too warmly welcome the extension of the role of virtual school heads outlined in this provision. I'd like to ask the Minister whether she has or will consider the opportunity in this bill, and specifically here in the bill, to consider the needs of children who have been recently bereaved or are facing bereavement, particularly of a parent or sibling, as a group of children who do have particular needs in relation to educational support. This is a surprisingly large group of people. Best estimates are that 1 in 29 children of school age have lost either a parent or a sibling. There's clear evidence that those bereavements have clear impacts on educational achievement as measured by GCSE results. So would the Minister consider the opportunity to use the bill to improve support specifically for bereaved pupils? I'd welcome the Minister's comments. Thank you.
I think it's over to you, Minister.
Thank you, Chair. So as we've discussed, Clause 6 places a statutory duty on all local authorities in England to promote the educational achievement of the children with a social worker living in their area. It also places a statutory duty on all local authorities in England to promote the educational achievement of children who are subject to formal kinship orders in their area, regardless of whether they have spent time in local authority care. Children with a social worker, as honourable members have recognised, often face significant barriers to achieving their potential in education due to experiences of instability, abuse and neglect, or indeed bereavement, as the Honourable Lady mentioned. Similarly, whilst children in kinship care benefit from familial care, they can encounter challenges stemming from trauma, disrupted schooling, or limited access to educational resources, which can impact their educational outcomes. Placing a statutory duty on local authorities to promote the educational achievement of these children acknowledges their specific vulnerabilities and barriers to attainment and ensures that resources and support are available to meet their educational needs. This clause places a duty on local authorities to appoint an officer to make sure these duties are properly discharged. In practice, the officer is known as a virtual school head and who currently discharges these duties on a non-statutory basis, but virtual school heads will be the lead officers responsible for overseeing the educational progress of children in care and previously in care, and it includes children who have left care because they were made the subject of a special guardianship or a child arrangements order. Extending virtual school heads' remit on a statutory basis to include children with a social worker and those in kinship care will give them the same legal footing as they have for looked after and previously looked after children. This clause places a duty on local authorities to take appropriate steps to support the educational achievement of these children, and that could include raising awareness of the barriers and challenges that they face in their education, taking steps to improve their educational attendance and engagement, and providing support to schools to help them overcome these challenges. This clause also extends the definition of a relevant child to include children under special guardianship orders and child arrangement orders. And I appreciate the Honourable Lady's question about the extent of that definition, and it is specific to the legal guardianship orders and child arrangement orders, and appreciate the issue that she has raised. I'll come to a number of questions that have been raised. I wanted to highlight, because I appreciate that honourable members have raised points of consideration in relation to this to make sure that we maximise the opportunity that this presents. And the ongoing evaluation of non-statutory extension of the virtual school head has shown that these extended duties do have positive impacts for children with a social worker, and virtual school heads have reported improved school attendance and decreases in suspensions and permanent exclusions. And so we expect the extension of this role, and now put on a statutory footing, to improve outcomes for some of the most vulnerable children, which we know this will positively impact on. And we know that virtual school heads have already been carrying out these duties, but we are fully committed to ensuring that they do have sufficient resources to enable them to meet their statutory duties. We've provided £7.6 million of funding this year to ensure they're resourced to meet their statutory duties towards previously looked after children, but we will continue to review resourcing alongside the impacts of the extended role to make sure that virtual school heads have those resources to enable them to meet their duties and indeed serve the children that they are there to support. And we will issue updated statutory guidance to give local authorities a framework to support the outcomes of all children they have a duty towards, and local authorities will be held to account for the discharge of these duties through Ofsted inspections of local authority children's services. That responds to the question raised by the Honourable Gentleman for East Hampshire. And in respect of the Honourable Lady for Twickenham and the question that she raised, apologies, I'm just finding actually, in response to the Honourable Lady and the question that she raised about bereavement, and indeed she's absolutely right to identify that many children who are in kinship care arrangements may well be there as a result of a family bereavement, and indeed I've had constituents come to me in that situation and appreciate the challenge, and we could have a very long debate around the best way of supporting children who have experienced bereavement, and I absolutely take on board her concerns, and there is a whole range of work that is undergoing in terms of the RSHE, the national curriculum, resources for mental health support in school that we hope will bring that supportive benefit to all children within the school system. But, you know, I will take away the specific request that she has made, as we are obviously undertaking an independent review of the curriculum to ensure that it does provide that broad and solid foundation to children, but also ensures that the issues that many will require in terms of the RSHE curriculum, the PSHE curriculum, and to ensure that children are equipped to process the challenges that and that we have the support in the right place. And it may be that can be provided through a school setting. It may be that should be provided elsewhere also. Did the Honourable Lady want to come back on that point?
Thank the Minister for giving way, and fully appreciate what she's saying regarding the way that the curriculum and so forth can be shaped to offer more support to children, a large number of whom will face some form of bereavement at some point. I suppose the point that I would particularly like to ask the Minister to take away and consider is the point about how the network of support around the school can work to support children facing bereavement, particularly of a very close relative, both in terms of the opportunity for perhaps grief education for teachers, but specifically here, somebody in the local authority looking at that subset of children with the same level of attention, given that they are, as a group, particularly subject to the challenges that this clause of the bill is specifically about. So hence the point about virtual school head responsibility in this area, if you take that away.
Yeah, the Honourable Lady raises an important point. I fear we get into quite broad territory here, which may well be considered not in order when discussing the role of the virtual school head, but I absolutely take on board that the virtual school head comes with a range of responsibilities in order to support the educational attainment of children that come under that authority, and obviously included within that would be to ensure that the measures that are taken do support children to deal with a whole range of challenging experiences that they may have experienced, which has resulted in them being within the remit of the virtual school head. So, I mean, I'll certainly take on board the lady's particular concerns in relation to that. To respond to the Honourable Lady, the Member for Twickenham, on the statutory duties on the local authority to promote educational achievement of children who live in kinship, regardless of whether they've spent time in local authority care. That is how the entitlement is worded. So virtual school heads will have a duty to provide information and advice on request to kinship carers with special guardianship or child arrangements orders, regardless of whether their child was in care. That is how the legislation has been framed. Obviously, they are legal arrangements that have been made with the local authority, which bring them under the direction and supervision and indeed responsibility of the virtual school head. And I appreciate the Honourable Lady has concerns in relation to that, and they have been noted. So with that, I beg to move that this clause stands part of the bill.
Okay, so the question is a clause 6 now part of the bill. As many of that opinion say aye. Aye. Contrary no. The ayes have it. The ayes have it. We now come to Amendment 12 to clause 7, with which it will be convened to debate Amendments 13 to 17, and I call Ellie Jones to move Amendment 12.
Thank you very much, Chair, and I'm pleased to be moving amendments 12 to 17 to clause 7 on extending staying put for children in foster care to the age of 25. And these amendments seek to address the potentially two-tier system under which this bill is extending staying close but not provisions for staying put. So we know that many care leavers face a cliff edge in care at the age of 18, and staying put is a scheme that's been put in place to enable young people in foster care to stay with those foster carers until the age of 21 to support them into adulthood, whereas staying close is for young people in residential care. But, you know, we need to note that in the UK it's becoming increasingly difficult for young people to reach independence at the age of 21. In fact, the ONS published a report last year showing that the average age at which young people move out of the family homes is in fact 24. And the independent review on children's social care recognised the disparity between young people in care and non-care experienced peers, and they recommended that both staying close and staying put be extended to the age of 23. So the bill has, it appears, responded to this recommendation by putting in place provision to extend staying close to age 25, but doesn't do the same for those in staying put arrangements. And so, you know, I've tabled this probing amendment really to ask the Minister to respond and explain the justification for that disparity and effectively the creation of a two-tier system for young people in these situations. Now, evaluations of staying put have found that it significantly reduces the risk of homelessness for care leavers, and the Care Review found that it would contribute towards savings of £84 million over 5 years, mostly due to reduced homelessness. Now, of course, it's not the financial savings that are the primary motivation for this. It's about what is best for young people in ensuring that they've got the best possible opportunity to successfully transition into adulthood. And foster carers and young people consistently report that extension of staying put would result in those better outcomes for young people, providing them with the choice, not insisting, but the choice to remain in the family environment. In the words of a foster carer who recently spoke to the Fostering Network about this, they said the increase in the age for staying put would be of amazing benefit to care leavers. At the age of 21, many young people who have had the opportunity to go to university are just obtaining their qualification and then have to face negotiating their huge next step, the job market, and find that they're possibly homeless due to leaving their placement. And this is a catastrophic step backwards. So I really warmly urge the Minister to consider ensuring that there is parity in the schemes for staying close and staying put, given that, you know, foster care and a family environment has the best long-term outcomes for young people in care transitioning into adulthood. Thank you.
Amendments 12 proposed to clause 7.
Thank you, Sir Edward. I just wanted to briefly make a comment in support of these amendments. I was talking to my Director of Children's Services for the London Borough of Richmond upon Thames earlier this week, and he was telling me that we use staying put quite a lot in a borough like Richmond, where housing costs are astronomically high, and social housing is barely available, because we all know there's a housing crisis across the country, but particularly acute in London. And so extending this provision, which allows those young people who are already in care, where, you know, the family, there's a strong relationship, and allowing them to stay with those family connections, I appreciate there's a cost attached to this, but actually for many local authorities it's a cheaper cost than trying to find housing for these young people, who will almost always really struggle to go on to find housing on their own. So I would urge the Minister to seriously take this away and consider the amendments that the Honourable Lady has tabled today. Thank you.
Anybody else? Minister?
Just to be clear, am I responding on Amendment 12?
Yes.
13?
You're
Just
responding
12.
to Amendment 12 to Clause 7, and you're responding to Amendments 13 to 17.
Great. That's what I thought. Thank you very much, Chair. In response to the amendments raised by the Honourable Member for North Hertfordshire, and indeed the comments made by the Member for Herefordshire, I'm sorry, I keep misreading it. I'm so sorry. I'll do lines. In response, I recognise the case that the Honourable Lady is making, and would say, though, that we want to prioritise those young people, often with the most complex needs, that are leaving residential or similar care placements at 18. The existing staying put duty requires local authorities to monitor and to support staying put arrangements where former children stay with their former foster parent after leaving care, and the duty lasts until the young person reaches the age of 21, as she knows. And this, as she rightly says, allows them to leave stable and secure homes when they are ready, and help them to enter adult life with the same opportunities and life prospects as their peers. And we remain absolutely committed to the Staying Put programme, but we are adamant that it's essential that we prioritise filling the gaps in current support, and in particular for those young people often with the most complex needs who are leaving residential at or similar care placements at 18. And that is why we have prioritised the introduction of statutory staying close duties, former by definition relevant to children under the age of 25, including those staying put or who have left the staying put arrangement, will be eligible for the staying close support. Any eligible young person up to the age of 25 will be able to access the wraparound, practical and emotional support package provided as part of the staying close duty. To be clear, we are aware of the financial pressures for young people, carers and families and local authorities at the moment, and we are committed to further reforms to children's social care in future spending reviews to make sure that every child, irrespective of their background, has the best start in life.
So do you wish to withdraw your amendments? Yes. So amendment by Leave withdrawn, and that applies also to 13, 14, 15. We now come to...
I beg to move that the committee do now adjourn.
Is it your wish that the committee do now adjourn? Are there many of that opinion to say aye? Aye. I'm contrary, no, and I think the ayes have it. The ayes have it. For the first time in 41 years, a bell has appeared, so I've wanted to do this all afternoon.
Committee Room 10, Sound.